Okay, so to address the first point that they made, that the revenues aren't used to address unhealthy behaviors, so the revenues from some taxes don't go to programs that help stop unhealthy behaviors. The whole point of sin taxes are to stop unhealthy behaviors, so the money doesn't necessarily need to go to programs, because sin taxes are already making people not want to buy these unhealthy things like cigarettes and alcohol. So the money doesn't need to go directly to programs to help people stop smoking or stop drinking. The sin taxes are already working against that just in and of themselves. And if all states increase their sin taxes, then the government can use the money to go towards healthcare, like Medicare and Medicaid. So, and Erin Hill from study.com said that by making it more expensive to engage in unhealthy activities such as smoking or excessive alcohol consumption, less people will do it, or at least not do it as often. So that in and of itself is bringing down the health risks of smoking and drinking and sugary drinks and that kind of thing. And Dr. M. Joyner and Dr. D. Warner of the Mayo Clinic said that sin tax revenue could be used to subsidize health care for uninsured patients and alleviate some of the strain on Medicare and Medicaid and promote increased physical activity. Also, the California Healthcare Research and Prevention Tobacco Tax Act of 2014 stated that increasing the cost of cigarettes has been shown to be the most direct and effective way to reduce smoking. So sin taxes are working on the level of reducing people's behaviors in these unhealthy arenas. Second, they stated that the burden felt by the taxpayer is too high. Well, the simple fact is that people don't have to buy cigarettes and they don't have to buy alcohol or sugary drinks or candy or what have you if they feel like it's too high. And if they don't, or if they can't afford it, then not buying these things is going to free up money for other parts of their lives. So it's really an unnecessary buy. And then as far as the consumer sovereignty, sin taxes don't take away consumer sovereignty at all, and people, Paul Samuelson, who's an economist, said that sin taxes are often tolerated because most people, including many cigarette smokers and moderate drinkers, feel that there's something vaguely immoral about tobacco and alcohol. So it's not like an outrageous idea for the government to put a tax on this, because these things are proven to be bad for you. And most people who smoke and drink excessively know that and accept that. So if they want to continue doing that, it's worth the tax for them. Also, the poor aren't unfairly taxed. They know exactly what they're going into, and the price is what it is. And if they want to partake in these activities, then that's what they're going to have to pay. And if they don't, then they don't have to buy them. And Erin Hill stated from study.com that because everyone who enjoys or participates in smoking, tobacco, or drinking, or not everyone enjoys or participates in smoking, tobacco, or drinking, it is much easier for the general public to accept that they won't be taxed and the taxes won't affect them, and that the money from these taxes are going to different programs. California's First Five program, which is a program that benefits children from 0 to 5, where 90% of their brain develops. They've gotten $3 billion so far from a tax on cigarettes earmarked specifically for public preschool and child health programs. So that's paying for the whole program for California to have better early education like standards and programs. So the taxes are going to something, even if it's not alcohol abuse or like cigarette or any kind of like abuse or addiction. Yep.